welcome everyone. Thank you for attending today's Michael Davis lecture during the winter quarter of 2021. Hopefully everyone is doing well and dug out from the snow this past weekend. The Center for Health Administration Studies is excited to shine a spotlight on research conducted by one of our faculty Sea Grant awardees, Professor Boaz Keysar, who has several roles on campus, including a William Benton Professorship in the Department of Psychology and the college. He is the chair of the Cognitive Program, the Deputy Director of the Center for Practical Wisdom, and the Psychology Chair of the Joint PhD Program in Psychology and Business. So he's a very busy man. In a moment, Dr. Jean Marsh, the Chaz Director and George Herbert Jones Distinguished Service Professor at the Crown Family School of Social Work, Policy, and Practice, will offer a brief opening remarks and introduce Dr. Keysar. If you have questions today, please feel free to type them into the Q&A pane to have them answered during the lecture. We also will have the chat feature enabled. If you have comments or questions, you can also interact with Dr. Keysar and his student researchers, Lee Burnett and Jeanette Geipel. Today's PowerPoint will be archived on the Chaz Davis Lectures webpage and can also be found at chaz.uchicago.edu. And a recording of this lecture will be on our YouTube channel shortly. We are now recording and Dr. Marsh will introduce today's lecture.
Good afternoon, all. I'm Jean Marsh, and I have the great pleasure today to welcome you to the Michael Davis Lecture Series and to our distinguished speaker today, Boaz Keysar. And I want to wish you a very happy Groundhog Day. Yeah, I think Keith has done a great job giving you preliminary background on Boaz. I can tell you that, well, Harold Pollack has really started a tradition of inviting the mothers of our Michael Davis lecturers to hear their sons or daughters speak. I didn't really have a chance to invite Boaz's mother, but I do know that she's an amazing woman with an amazing recipe for haroset, which Boaz kindly shares with friends and colleagues. So, while she can't maybe enjoy the lecture today, we have recorded it and she'll have the chance to enjoy it later on. So besides being a very good son and a very distinguished scholar, what can I add to the introduction Keith has provided? Basically, Boaz is an incredible expert in judgment and decision-making, basically how we solve problems and how we think, and the specific factors that affect our thinking. Today, he is going to speak with us about the impact of foreign language use on health-related decisions. And he will first introduce his colleagues. And so please join me in welcoming this distinguished team of health decision analysts. Thank you.
Thank you, Jean. This is very kind of you, and I appreciate being invited to give this talk about our work. So, and I'm also lucky that I have part of my team here, Jeanette Geipel, who's a postdoc and joining us from Italy, and Lee Grant, who is my senior graduate student. And it's really, really important that they're here. First of all, they did most of this research, but that means that they also know the details so they can save me when needed. So the work in our lab is about how the use of language affects decision-making. That's broadly speaking. And the reason that I do all this work, in fact, the reason I always do research, is always autobiographical, typically related to my wife. So here's the story for this one. So I did a lot of work on on communication and miscommunication, just to prove to her that I'm not the only one who, miscommunicates all the time. But this one, this work, I'm in charge of investing in our family. And even though I know nothing about investing, so all our decisions about retirement. And she's in the business school, but I am the one who's in charge of that. And being a rational person, I put all our retirement in the stock market, in stocks, just looking at the data. And what happened in 2008, as most of you probably remember, within a week, our retirement was worth about half its value. She was not happy, not at all. So my defense was very curious. My defense was that I'm not to blame, but it's the fact that I made the decisions in English. My native tongue is Hebrew. I'm using English. It's not my name. I speak it okay. I speak it well, but it's not my native tongue. And that made the difference and allowed me to be a lot more risk taker. So, of course, she wouldn't just buy this claim. I had to develop a whole program of research to try and convince her. And so I'm going to give you a sense of that program of research. Maybe you will believe me. The reason, so anybody here in the audience who speaks more than one language knows the difference it feels to use a non-native tongue. Even if you speak it well, it just puts you in a completely different mindset. And there is research on this showing that people react very differently to childhood reprimands when they are, so they, you sit in an experiment and they kind of give you a reprimand, go to your room or something like this. If it's done in your native tongue, physiological measures of arousal are way stronger than if it's done in a foreign language. People report that saying I love you is a lot more meaningful to them in their native tongue than in a foreign language, even though the point is, it means exactly the same. Je t'aime means exactly the same, and you know it. Nonetheless, your experience in the language is very different. You can also see it in how people use foul language. I'm sure everybody has an experience with a non-native English speaker using the F word way more liberally than is considered, that is acceptable here. Why? Because it doesn't have the same emotional impact. So these are just some examples of things we knew before we started our work, that the language just doesn't feel the same when it's foreign. So what I would like to convince you is that our native tongue actually is heavily involved in our decision-making because it's native. It changes the choices and the judgments that we make because of the psychology behind it, because the native tongue connects us stronger to our emotions. It connects us better to our memories, to our experiences, and to our self of sense and identity. And as a result, we make decisions differently. And to quote Nelson Mandela, if you talk to a man in a language he understands, that goes to his head. If you talk to him in his language, that goes to his heart. That's the gist of it. Now, let's see that in what way it actually affects the way that we make decisions. And then the second part of the talk, I will show how it has applications to health decisions. So this is the plan. I want to first tell you about the kind of discoveries we've made along these lines, about how language, the use of language affects decision-making. Then I'll talk about two applications that we studied. one to mental health decisions and another one to vaccination decisions. And this is also a very good opportunity to thank our funders for this. Chaz has been very generous to us and helped us do this research. Scissor from the University of Chicago as well, and the National Science Foundation. Okay. By the way, to just second what was told initially, I think Keith mentioned that feel free to interrupt. I will be very happy to get questions, no problem. So just a few methodological points. I'm not going to dwell on methodology at all, but this is kind of important to understand our approach. We do research experimentally. We just need to control things, control freaks. So what do? We compare how people make decisions when they use their native tongue to when they use a foreign language. So we take the same people. That's kind of the really crucial aspect of the work. We take a group of people, all of them sharing the same native language, and all of them sharing the same foreign language. And then we randomly assign them to do the task either in their native tongue or the foreign language. So this allows us to make inferences about the impact of the particular language. We put them typically in a fairly consistent language environment. From the consent form to the very end, everything happens in the designated language so that they stay in that mindset. And we have very kind of clear definitions of who qualifies as a foreign or native speaker for these purposes. And what we typically do is we make sure that you fully understand everything, because if people just don't understand what we tell them, that's not interesting. So we test for that after the fact, but also you must not have used the foreign language when you were a child. You learned it fairly late in a formal setting, and not spend 6 months or a year, I don't remember, in a language, in a country that uses that language. So if English is your foreign language, you lived in the US for more than a year, you don't qualify. We have other qualifications there, but that's the main thing. So let me give you an example of a particular study that we did to investigate the way people make moral decisions. This work was in collaboration with my dear departed friend Albert Costa, who died way too early a couple of years ago, and my now graduated grad student Sayuri Hayakawa, who basically that's her work. Now, interesting, what I'm going to tell you was also done, the same idea was done in parallel by Jeanette Gable when she was not in my lab, exactly the same studies, independently of us, exactly the same results. And 4 other labs around the world did a very similar thing. So I'm very, very convinced about the validity of these results. So what did we do? So moral dilemmas are basically kind of go to the core of our moral fabric, right? So here is a dilemma that sailors faced in this maybe about 100 years ago, in this ship, the William Brown, that it sank in a storm, and only one lifeboat was spared, and on it were like 32 people. And it was very clear to them that the boat is not going to carry them. It's going to sink with so many people in that storm. They had to make a choice. what to do. All of them sink together, or some survive and some don't. That's a moral dilemma, and that's the kind of moral dilemma that we dealt with. What happened was the sailors basically decided to throw all the men off the boat and save all the women and children, and they actually eventually made it to safety. And there are all sorts of legal issues that came out of that. So this kind of moral dilemma has been studied in philosophy and psychology, and probably the most famous instantiation of this is the following. It's called the footbridge dilemma. Imagine that you're standing on this footbridge and a little trolley is coming down the track, and there are these 5 men who are basically, they're working on the track, but there's just no way to have them move. Assume that they're tied to the track. So the train is going to hit them and kill them. There's no way for you to stop it, except you see that big guy behind you. You can push the guy to the track. He's big enough to stop the train. You kill the guy, you save the 5 people. Would you do it? That's the dilemma, right? Is it okay to kill 1 person in order to save 5 people? So, of course, this is contrived, but it does kind of capture the essence of the boat decision that I gave you before. And you can think about it as a moral stress test. So people, when you ask them this, and hundreds of studies have been done with this, most people say, I understand the calculation. 5 is better than 1, but I just cannot do it. I cannot kill a person with my own hands. And I'm sure that most of you will have the same reaction, because we know, only about 15% of people on average say, yes, I'm going to save 5 and kill 1. So we use that in order to test the idea that this kind of decision might actually be language dependent. It is, before we did it, I didn't really believe it's going to come out, because it's really a crazy idea. The moral choice is a conceptual issue, right? 5 or 1 should not depend on whether you're using your native tongue or foreign language. As soon as you understand it, you should, your moral decisions should be operating on the kind of representation, in a way, of the problem. And the representation of the problem is not supposed to be language dependent, right? So we shouldn't find a difference. However, we did expect that more people will be willing to push in a foreign language, and that's exactly what we found. So let me explain the data here. This is y-axis is the percent of people saying, yes, I will push. That's what's called a utilitarian choice, because it really just takes into account the maximum good, in a way. 5 is better than 1, as opposed to what's called a deontological decision, which is not to kill a person because it's not allowed. It's just not morally acceptable. So what happened? When the subjects were native speakers of English and foreign speakers of Spanish, you can see on the left, when they received the problem in Spanish, they were about twice as likely, more than twice as likely, to say, yes, I'll push. I'll kill the guy. The exact same thing happened with Spanish native speakers when they were using English as foreign, only that now it was English that got them to push, right? So it's not an issue of the particular language, Spanish versus English. It's not an issue of the culture associated with the particular language here, but it's the reaction. It's the emotion that, well, it's the reaction to the language that made them make very, very different choices. So Sayuri followed this up with an attempt to actually explain it more systematically and use the method which is called process dissociation, which is not important for us to get into right now, but it allows us to distinguish between the underlying motivation for this choice. So the question is, are people more utilitarian in a foreign language because they're more reflective, they're calculating, and then they make the choice to go for the maximal greater good? That is one interpretation of our data. Another one is that they're not as committed to the moral imperative to not kill, maybe because of the emotional distance that the foreign language gives them. And so they're more willing to violate these norms. And the data that we collected using this method supported only the second one. I was rooting for the first one, but no, when you use a foreign language, it's not that you're focused on the greater good, but it's that you get a release in a way from the obligation that the norms put on you. So this is an example of this, of the kind of studies we did. And here's a list of things that might be interested for people, the phenomena that we find by manipulating the language that people use. So I talked about moral dilemmas. We also find that people cheat more when they're using actually their native tongue, when they're not accountable. We're not talking about major cheating, stealing $1 here, $1 there. A lot of work we did on perception of risk and benefit. This is actually the work of Jeanette Gapel and Dinos Hadjikristiris. Basically, people perceive. So if you tell them about certain technology, they think that the technology is less risky and more beneficial if they hear the description in a foreign language. This has huge implications, of course, and it's consistent with the idea that they're not reacting as emotionally to the risks and benefits that they are considering. We found that people are more willing to take risks, like me in the stock market. In experiments where people have a choice whether to take a risk or to take a sure option, and they actually get paid more if they get paid according to the outcome. So there was kind of an incentive involved, and people take more beneficial risks. What is beneficial risk? If you can decide between getting $10 for sure, or we'll flip a coin and we'll give you 25 or nothing, expected value is better on the bet because it's 25, 50% better than 10. People are very averse to this kind of bet, but they're not as averse when you give them the choice in a foreign language. If you do this 100 times, you should come out ahead. And this is not very different from investing for people who invest for a living in the stock market. Another work that Jeanette and Dinos did was about how people are kind of obligated by norms. All sorts of norms that are not that that if you violate them, people there are no victims really, right? Things like well, the examples that come to mind actually. Jeanette, you want to give one example of this that'll be palatable?
Yeah, for example, cutting in line or a white lie, something.
Right. Okay.
Like this, yeah.
Cutting in line is a great example because it is a very strong. There's a very strong norm against this in the United States. not really in Israel. But people feel, are more willing to do it if they are operating in a foreign language. That's going to be important for us for later, because the work that I'm going to talk about with respect to health decisions is going to be related to the notion that a native tongue basically is part of what keeps you kind of in line with the norms. Another thing that we found is that if you describe something to people in a foreign language, their imagery that they conjure up is different. So if we actually tell them, imagine a sunset, or imagina una puesta de sol, same thing, they understood it just the same. They report the image in their mind to be not as vivid in a foreign language. Your images in a native tongue are more vivid. I mean, again, it's sort of crazy, because really, I mean, you should be thinking about, okay, let's conjure up a sunset. Why should it depend on a foreign language? But it does depend on the language. And we also find that this kind of imagery also is partly mediates some of our effects. All right, so, and Lee has this very interesting project on false memories, where it turns out that there are a lot of phenomena where we believe in memories that actually of things that never happen. I'm not talking about misinformation or kind of directly manipulating people's memories. Just we all have false memories because we think it happened, it didn't happen for all sorts of reasons. They are much less frequent when the memory, when we do the study in a foreign language, much less frequent. People are way better at monitoring reality in a way, monitoring what they actually saw versus what they heard, for example. All right, so this is just a taste of the range of the studies that and the flavor of the work that we have done. And now I want to talk about how this applies in our work to, oops, did the wrong thing here. How this applies in our work to health decisions, which is kind of a relatively recent interest of ours that is developing more and more. I think it's a common phenomenon that as people get older in their research, they become more interested in why should we care about this question? And health decisions, you don't need to sell that it is important. So I'll talk about two lines of research. One in mental health, and they're both related to kind of norms and stigma. One in mental health, where we find that foreign language kind of sort of releases you in a way from a norm, from cultural norms, specifically a stigma that is associated with mental health. And the other one about vaccination decisions, very, very topical, but we actually did it before, where the idea is that because a native language keeps you so close to the norm, it actually helps get people to vaccinate, in our data at least. So let's start with the first one. We actually have, so Lee, Lee and Uriel was an undergrad here, but he was a major figure in this research. He kind of initiated it in a way. And Miwa, who is our very own here, was very critical for this research because she is actually an expert in these kind of decisions, especially the cultural aspects of health decisions. So that's the team. So there are big differences between cultures in how much having a mental health problem and getting mental health treatment and all these things, how much is that stigmatized? So I think the United States is probably on one extreme of very low stigma. right? I mean, in New York, you can, everybody's got a therapist or two, and probably in Chicago too. I think half of my Jewish friends are therapists, and I also found that some people kind of combine educational therapy with tutoring, all sorts of stuff like this for children. So not a lot of stigma in this country. In contrast, Chinese culture very much stigmatizes mental health problems, especially among immigrant community. And that's where we started. An immigrant community, immigrants to the United States from China, how their reaction to the idea of having mental health problem is very different from your non-Asian American. Now, I'm talking about non-immigrant Asian American. Okay. So here is a few numbers for this. You can see that the number of psychologists or psychiatrists per 100,000 people in the United States is way, way bigger than China and Vietnam and Philippines and so on are. And I think Israel would look very much like the United States. Okay. So we did this study with Chinese students who came to the US just to study. So they were, basically we had approached almost every Chinese student on campus in order to do this. So their native tongue is Mandarin, and they use English as foreign. And the question is, how would they evaluate a situation that involves mental health problem or the need to get therapy for it? So how did we do it? We asked them to evaluate a person who is basically like them, and he has all sorts of issues. So he's feeling really sad for the past 2 weeks. He wakes up with heavy feeling, no longer enjoys things, can't get through the day, and so on. And we asked them whether they think that this person should go see a therapist as an indication of how strong the stigma is. Right, so this is the scale we used, from definitely not 0 and 100 as definitely yes. They received the information either in Chinese or either in Mandarin or in English. And here are the data for this. You can see that when they got it in Chinese, their average was about 76%, 76 out of 100. So, they were willing to send him to therapy, but they were a lot more willing to send him to therapy when they evaluated this person in English. Okay? And we took this as an indication that the native tongue here kind of keeps the norm alive in a way, whereas the foreign language releases you from the norm, from the cultural norm. So their cultural identity does not play as much of a role as when you're using the foreign language. Then we looked at different levels of expressed depression. So we said, imagine that this guy is still socializes and works. In other words, he's still functional. Or a more severe would be doesn't socialize at all. A high level of depression we described as doesn't even go to work, and then the most extreme doesn't get out of bed, which is your typical progression in depressive phenomena. So here are the data for each of the different levels of severity, and you can see that when you answer in English, you constantly are more willing to send him to a therapist. First of all, it goes up, right? The fact that it goes up is good because it means people are paying attention. When the symptoms are low to moderate, they're way less willing to send him to therapy than when it's extreme. But at every level except at the very top, you're more willing to send him to therapy when you do it in English than in Chinese. When it's very, very extreme, everybody says, yeah, it's time to go. We did a few studies like this. I'm going to describe them quickly. The second study, we moved to Beijing. We used our Beijing, University of Chicago Beijing Center. And we wanted to see if, Chinese in general, not just people who are uprooted and operating in the United States, do they also show us this phenomenon? And we didn't replicate it. That was temporary, what do we call it? Unhappiness. Then we realized that we did make a certain change between the first and the second study, which is we added questions first before they actually answered about mental health. We asked about physical health, and we suspected maybe that was kind of affected the results. So we did it again, now with again in Beijing. And we basically were evaluating now whether it's because of that question or because it doesn't happen in China. It has to be with immigrants. And here are the results. We actually did replicate. Once we removed the question, we replicated it very nicely, even in the high level of depression. We still get a difference. But the effect is consistent. In English, they are more likely to send him. I don't know why the colors flipped between the first and the second graph, but yes. So if it's really the association to stigma, if it's really the fact that there is a Chinese, in Chinese culture, there's this strong stigma to the cultural stigma against mental health, associated with mental health, then we shouldn't find this in places where there is no such stigma. So we did this in Israel, where basically the approach to mental health is very similar to here. And what we find is no language effect at all. In other words, if you remove the culture, you don't see the cultural difference. You don't see the difference. In other words, it is not just the fact that the language is foreign, because the language was just as foreign to the Israelis, but they did not show a difference between the two languages. We conclude from this that, yeah, it is likely that we're talking about cultural identity, that the language moves you towards or away from, that is affecting your mental health decision-making, in this case, decisions for other people, right? For a friend or something like this. Okay.
We have a quick question.
Yes.
So we were asked, is language a proxy for culture as a construct? I think you touched on this, but I wanted to make sure the question was addressed directly.
Is it a proxy for culture? So what does it mean to be proxy for culture? I think if the way we think about it is that the language, you can think about it, as primes the culture here, right? It primes the culture, and then the culture in these studies is what is doing the work. Language here has a causal impact by getting you to the culture or away from the culture, but the culture is what is actually affecting your decision. Now, this is different from the moral dilemma study that I showed you, because I showed you there that culture did not have any effect, because we get exactly the same effect when you cross the languages, right? So Spanish is associated with one culture, English is with another, but that association didn't do anything. It was really the foreigners. Here, we believe it's the culture that is prime that is doing the work. In the next study, I think that the foreignness of the language is what is more likely to be the one that is going to do the work. But again, we don't have direct evidence to this, but it's definitely has to do with the norms that the language connects you to. So in this study, this is the team in this study, and you already know Jeanette and Lee, and Julie and Marius are from the University of Chicago, associated with the student health. So that was very important for us, this collaboration. So, vaccination. Let's see, so I don't need to convince you that vaccination hesitancy is a major problem today, right? In fact, it is a major problem. According to the World Health Organization, it's one of the 10 threats to global health. And that's, I don't think we're even talking about COVID. That was even before there was a vaccine for COVID. Nobody had an opportunity to hesitate. And in general, there is, a lot of people are afraid of vaccination. And there are all sorts of cults, groups in different places in the United States, like California, and it's independent of socioeconomic background, people who just believe all sorts of unusual things about vaccination and refuse to vaccinate. Now, I think that's partly why the WHO find this as a major threat, especially because of pandemics, right? And we see it now. Now, with the language comes into play, especially for immigrant population, because these people make decisions typically in a foreign language, typically in the new language, the country they are, in the language of the country that they moved to, which tend to be foreign to them. Now, there's a lot of literature on the problematic nature of that. A lot of it has to do with, people just don't understand that language. And so there's issues of comprehension. There are issues of the need for translation and so on. We didn't focus on that. We focused on people who are perfectly able to understand English, in this case, as a foreign language. And I think that the example I have here, like 2017 in Minnesota, the Somali community was a big outbreak of measles. That's a result of the anti-vaccine movement, who managed to convince them of that. But we think that language here can play an important role, and is playing an important role in the way people make decisions, especially the way that it kind of connects us to norms and maybe also trust. So we focused on the HPV virus, the human papillomavirus. That's a virus that is, very, very common sexually transmitted infection. And so it is actually a virus that is important to get under control, especially because it could cause cancer of cervix, vagina, vulva, and penis. Now, the interesting thing about this virus is that it can cause cancer, but there's also a way to prevent it. In other words, you can prevent that cancer by vaccinating for HPV. Now, not too many cancers, can be vaccinated against. This is a major advantage, right? I mean, we typically think about cancers is a lot more, we are a lot less able to get it under control. Here is one that we can actually get under control. And again, I'll quote one of our own, Lauren Salisbury, who says that the vaccine against HPV is safe and proven cancer prevention method. So it could really, there's no reason for people to get cancer from HPV. However, there is a lot of vaccine hesitancy when it comes to HPV, not necessarily in this country. I think that most people get it as a routine thing in their doctor when they're growing up now these days. But in all over the world, it's under-vaccinated, big time under-vaccinated. So we looked at people who came to this country, again, the students, and were way under-vaccinated for HPV. Young adults, they could benefit from this. Can we help them? Does the language make a difference? That's the question. So we prepared material from the CDC. Yeah, from the CDC, you can see the English, that's the original. Actually, both of them are original because the CDC has it in many languages. And so we took the English and the Mandarin pamphlets and used that to explain the need and urge our subjects to vaccinate for HPV. How did we do the study? We sent them an email, and actually I think it came from Julie, so from the Student Health Center services, and they read, we hope, the information about the vaccine. And then again, let me remind you, it was randomly assigned to either do it in English or in Mandarin. And then they were asked if they are going to intend to get a vaccine. So intention to vaccinate is one measure. And if they do, they have an opportunity to make appointments to get the vaccine. So here's the kind of overview of the study. In the first phase, we had 210 subjects doing it either Mandarin or English. And then the second phase, we send them an email after all that. 3 months later, we sent them an email and said, well, we remember that email we sent you before. We were wondering if you got the vaccine. Right? So we actually asked them about whether they did get the vaccine. And so we have a measure for that. So here are the results. So first of all, language did not make any difference for intention to vaccinate. Gender did. So women were much more receptive for our communication. And we suspect that this has to do with the misperception that HPV is more for females than for males, that males cannot benefit from it because there's a long list of things that female can benefit from it, and the males probably don't even read the rest. So they sort of deny in a way, but I don't know. We don't know what is the actual reason, but it's likely that it's HPV specific. Then here's the email we sent them and said, did you get the vaccine? That's in Chinese. And here are the results. Now, it turns out that it totally depended on your gender. There was a very strong interaction between males and females in their, first of all, there was a big difference in actual vaccination as a function of gender. Males were much less likely to go get vaccinated. Females, you can see, after we send them the message, we got between 50 and 75 to go get vaccinated. That's not bad. You know, if we do nothing else, that's already something that I guess these women were benefited from the study. But for us, the important thing is, females are more likely to get vaccinated if they receive the message in Mandarin than in English. For males, it was the opposite. We don't know why, but it might have to do with, how much they consider this to be important. We actually don't know. But for females, this difference is very, very promising for us. It's not a huge number of people, but they are randomly assigned, so we can at least, and it's significant, so we can at least use this as a first step for a much bigger research program. We also asked them questions that we used as moderators, basically to see how much they kind of tied to the norm of getting vaccine. Your parents, do they think you should get vaccinated? Your best friend, what do people around you think is a good thing to do? What about your doctor? Things like that. And we find somewhat of an effect of this kind of adherence to norms, right? I mean, people who are more likely to say yes with our people around us really do promote vaccination. That sort of could partially explain the effect for females. So that is what we think is going on, that the language here sort of connects you more to your to norms, and just like in the moral dilemma thing study, and promotes vaccination in this case. So last thing I want to say is what are we planning to do next, which is, it's sort of, we sort of have to do this. We look around and you see the huge vaccine hesitancy around the world, but also in this country, where the consequences of that are immense if people don't get vaccinated. We are considering two directions, and here actually we have experts on health in the audience, so we would love to hear from you what we could do with respect to language, or anybody who wants to get involved, collaborate, or and so on. So two ideas. One is very similar to the HPV. So imagine there are a lot of Hispanic immigrants in this country who use Spanish as native, English as foreign, and vaccine hesitancy for HPV, for COVID, is a lot bigger, a lot larger among this population than among white Americans. If they receive the message in English or in Spanish, that could make the difference, just like we showed in our, so giving them the message in Spanish might reduce vaccine hesitancy. Another completely different direction, nothing to do with foreign language, but Jeanette has this very interesting line of work where she finds that the modality of a language, if you hear it or if you read it, makes a difference in how you perceive risks. So if you want to know about new medication, you can ask Alexa to tell you, or you could check it on the internet and read exactly the same information that Alexa would have read to you. So you either read it or you hear it. What we find is that you perceive the risk of the novel medication as less and the benefit as higher, right? So it feels less risky and more beneficial if you hear it than if you read it. So Alexa could actually help you here. So basically the study that we would do would be clearly to manipulate modality. Do you hear about it do you hear about it or do you read about it? Does it make a difference for your willingness to get vaccinated for COVID?
We have a question.
I'm almost done. So this let me just finish that and we will open it to questions. So unless it's specific to that. No, let me finish. I'll finish. So so basically the implication is that the theoretical thing is that, you know, it makes a difference that we connect to our imagery, our emotions, our identity. Language makes a difference, affects our decisions. And that has implication for health decisions. The words of the Turkish poet immigrated to Germany. She says that my German words have no childhood. I think that reflects that sentiment. So what I would like you to do, the main conclusion for me is that I'm really not to blame for anything because I use English most of the time. And this is my wife's email. If you could just email her and tell her that you agree with me, I will appreciate it. Thank you very much. All right, so questions?
So we got two from the same person. I'll start with the first one. Thank you so much for the questions, by the way. We love questions. Gender disparities research shows women are more compliant in healthcare situations. Is this the same as being more norm compliant?
Interesting. So you see, the norm compliance might be explained, I think that in the data that I showed you with HPV, you saw that females were much more likely to get vaccinated than males. I think that is the norm compliance that you're talking about. The language effect is within gender, right? The language effect is for the same woman, right, who already is more compliant. If you change the language, she becomes even more compliant in the native tongue.
I think
So
too.
On top of it, basically. Go ahead.
I think too, just to add on a little bit, the
Yes,
the social norm moderator that Professor Keysar just discussed, I think is more of kind of the variety of social pressure. So how much friends, family, your doctor kind of wants you to receive the vaccine, influencing your actual uptake. If that kind of, I think, clarifies, because I know norms are somewhat a nebulous term, but in this case, it's more that kind of social pressure norm seems to be potentially moderating the effect. And then we have a second question, which is, there's been much discussion. Oh, wonderful. Second question. There has been much discussion of COVID-19 vaccine hesitancy amongst the African American community. What are implications of work for this problem?
What are implications of our work to vaccine hesitancy of COVID? So I think that it will be very interesting.
Or is the AA Asian American community? I actually should specify.
Oh.
Yeah, I just realized after I read it, I was not sure, which is, what AA is this?
Okay. Yeah, I don't know about the other AA, but actually it might be an interesting thing to look at. So Asian Americans, well, as far as I can tell, Asian Americans do not show greater vaccine hesitancy, and I'm not an expert, but just by kind of checking this briefly, they don't show greater vaccine hesitancy than non-Asian whites.
We did just get a clarification. It was actually African American. Thank you.
Everybody is an AA, I guess. So you know, the African American, there's great vaccine hesitancy there for all sorts of historical reasons and so on. And we think that the modality manipulation that I mentioned would be really good to kind of evaluate with them. So would they be more willing to get vaccinated if they hear it than if they read it? Why? Because they'll perceive the risk as less and the benefit is higher. So that's exactly the direction we want to take. We want to focus on that community for this study. And of course, there are other things that could help because they could hear it from all sorts of Black role models, which will be on top of it. But that is, this is not, yeah, okay.
So we have another question, which is how might trust or mistrust in the healthcare system factor into your findings? Which I do have an answer, but Boaz,
Go ahead.
oh, should I?
And Jeanette also, if you have any kind of comments.
I think Jeanette's gonna have to help me with this because that's a great question. So Boaz presented one of the moderators that we had included in our study, but we actually had a few. We actually had one moderator specifically looking at this question, which is a big predictor of vaccine uptake more broadly, is things like generally, do you trust the healthcare system? Do you trust things your doctor tells you? And we used a specific scale, but I've forgotten the name of it. Jeanette, do you recall?
We just actually ask, how much do you trust the information? So,
Oh, but there was also the how much you trust your doctors. It was a standard scale in the moderator.
right, it was like the social norm kind of line. Yeah, I don't recall the name of the scale, but it was like.
If you are interested, feel free to email. We'll be happy to get the scale. But it was a series of 10 questions to get to this. This did not moderate this effect, but we did look at it. But thank you. That was a great question.
But we do see in our data that in the native language, so if participants see the information in the native language, they do trust more the information. So we do see a correlation, which was significant.
Yeah, I'm sure that that trust is crucial for getting people to get vaccinated, and that, and as Janet said, in a native tongue, we tend to find more trust. So basically, the implication is if you use English with native Spanish speakers in this country, you're basically undermining trust just by using English.
Yeah, if I just could add something. So in fact, there are some studies suggesting that especially amongst Hispanic populations, they feel less, they trust less the vaccine efficacy, but also the vaccine safety, and that is correlated with their social identity. So how much they feel socially connected to their community. So we do think that perhaps here language would be an amazing intervention, very cost efficient, to increase this kind of feeling. I'm connected to my Hispanic community, and I see the greater good to vaccinate, and that might also help to increase their trust in the safety of the vaccine, especially amongst those who are hesitant.
Yeah. So I just realized that there's a couple questions in the Q&A. So thank you guys. So starting with the first question, with Latinx populations, legal status, I guess, is it a confounding variable? It's not a direct cause of vaccine phobia. I suspect Puerto Ricans will have higher compliance if my theory is correct, or legal residency.
So how would legal status interact really with our finding if we actually we could look at that. We don't know because we don't know the legal status of our subjects, and I don't think we used Latinx here. We used in some studies, but not in the health studies, Latinx community. It'll be interesting and probably very important to think about how this might interact. I don't have an immediate thought about it, but I would guess that the extent of the mistrust would be even bigger for people who are not, whose legal status is not, what do you call this? Who are not here legally. But I don't know. But it's important question for us to get, because if you are going to go and do the study with Hispanic population in the US, we should collect that measure, except that it is a little risky for them to actually give it to us. So I don't know exactly how to do it, but we might be able to find a reasonable way to do it. Safe way to do it, I guess.
So the next question is, so when was the HPV vaccine study conducted? The HPV vaccine was only available in mainland China quite recently. So it might make sense if those who are fluent in English would be more interested or might even actively seek the HPV vaccine in Hong Kong or the US. Was this taken to account in the study?
So when did we do it? I think 2 years ago.
Yes, I think so. But I think one important caveat is all of the people were based in the United States at the time of the study. So you had to be in the United States at the time. A big reason is there's also some cost differences in the HPV vaccine specifically. So when students are here in the States, you can actually get it from the Student Health Center for free. Whereas in mainland China, we looked into it at one point, and even right now, so we actually are looking at following up on the study. So we had to look into the cost in mainland China. It can cost hundreds of dollars to still get it, kind of depending on where you are, what your insurance situation is. So in this particular case, they were students from mainland China, but they were all in the States and hence had the same access opportunities across language conditions. But it's a really good question.
All right. Yeah, I think it costs the university about $300 every time somebody gets this vaccine. So by sending them all these people who wouldn't have otherwise gone there, we cost them thousands of dollars.
Well,
But saved the healthcare system money from people not getting cancer down the road. So
very
net profit.
Yeah, the long-term saving way outweighs the short-term cost. Yeah, which is true for vaccination, I think, in general, right? I mean, yeah.
Are most of the test subjects well-educated students, and how might this bias your findings?
I think that when we're talking, the non-health studies typically had well, there were a lot of studies that we did that had a range of backgrounds, people, because we would do it on all sorts of platforms where people from all sorts of socioeconomic backgrounds would participate. Some of the studies we do on campus, but the health ones, I think that's true, right? That the participants tended to be educated. How would that impact the? Well, again, what we find is we take this educated group and we randomly assign them to do it either in English or a different language. We find an effect, right? I'm not sure why less educated people, if you do the same thing with them, that you would not find the same language effect if they know the foreign language. I don't see a reason to think that it's not going to matter, but we will have a much better answer after we do the next study that we have prepared to go almost in Hong Kong with foreign domestic workers who are way less educated. And we'll see if we get a similar language effect there as well.
Awesome. Do people have other questions?
Can we just ask them?
Oh, yeah, I think
And this is Jean again. And my question I was starting to type, can you hear me?
Yes.
Is that I really appreciate the fact that you guys are control freaks and the care and precision that goes into your methods. But as you think about implications, as you think about policy implications and program implications, as we've been talking about it, how do you think about generalizability? Is that something you worry about or think about at all?
So generalizability means very different things in what we do and what and the kind of things you're talking about. And I think what you're asking is, would the controlled study generalize to the real world, right? And I think it's a very important question to ask, because when you have all sorts of things happening on top of what you're interested in, it might not make a difference anymore. It might drown the effect of the language, or not. I think this is completely an empirical question, and we are interested in going down that path. In other words, we are interested in doing a study that will be in the real world with real decisions, and in sort of as close to kind of not as close in real vaccination decisions, because the language manipulation that we have doesn't really require artificiality. Because, if I give you all I do is I give you a pamphlet in English or in Chinese,
Right.
or in Spanish. So yes, there might be TV on, there might be whatever. Yeah, that will add noise, but it'll be really important and interesting if this kind of study, that is basically a field study, would show these kind of effects. And in a way, the study I mentioned in Hong Kong that we're going to do is going to be a field study like that.
Oh, that's great. So what does that mean? You'll go into vaccination centers, or you'll do
No,
what?
it's not vaccination. It's following up on the HPV study and seeing if these women will be willing to get a sample, self-sample kit that would tell them if they have HPV or not. So it's like the first step. And that is for real. I kind of collaborate with a researcher from Hong Kong and an NGO whose mission is to get them vaccinated.
That's great.
So we'll see. But I think it'll be even more important, and we will be very, very happy to do a COVID vaccination study, because first of all, it's a huge opportunity, but if there is a benefit from taking language into account, it could be very consequential.
Right.
I would like.
So
Go
if
ahead.
anybody there wants to do it, let me know.
I did want to just quickly add, specifically with the HPV study, a big reason for why we chose the specific materials that we did. So rather than us writing up our own HPV information, is we got it specifically from the CDC website, because this both mimics the kind of situation that you get in a healthcare setting where someone gives you the information on like a treatment. Like we've all gone to the doctor and they've been like, oh, do you want the information sheet? I actually got the flu version of this from UChicago hospitals one time. But the thing is even just right now, the CDC has wonderful translations of a lot of different common vaccines, a lot of different health information in like 20 different languages. The translations are beautiful too. We checked them all. There was like no corrections to be made. They do an amazing job. And so I think that one of the things that we kind of always had in the back of our minds is if language really is important, it's as simple as you can just print out their native language version and give it to them if it really does like nudge towards better health decision making in certain contexts, would be our hope.
That's great. I don't know if you saw the opinion piece by Adam Grant about how to strategies for diminishing vaccination reluctance for COVID-19 vaccine. But he was a social psychologist taking a very different perspective. But I think what it points out is that we're all worried about that, and the relevance of social psychology to these kinds of decisions at this critical point in history are really important. So yeah. Go for it.
Yeah, great.
And if we don't have, oh, go ahead.
I was going to say we have another
or questions.
We have another question.
Oh, good.
So this is from David. So this is, should medical consents be offered in the native language? This involves weighing the costs and benefits as well as cultural values.
Medical consent. We don't really find, I don't think, but correct me if I'm wrong, we don't really find differences in willingness to consent to our studies. So it's not medical consent, but it's sort of analogous to this. When every time you start a study, you have to consent, right? And we don't find a systematic difference in willingness to consent.
Although, is this consent as in consent to a medical procedure or consent to a study?
Oh.
So I could see differences.
Oh.
In general, we tend not to have a lot of people not consent to our studies because they're pretty minimally invasive.
Yeah.
If it's medical consent to a procedure.
So I don't know the literature on consent for procedure. I would doubt that people say no. You know, it needs to be pretty extreme. I mean, if you get to the point where the doctor says, yeah, we agree that we're going to do it, you just need to sign this, right? I mean, it's not like first they consent and then they talk about it. You know, I doubt that there is going to be a language difference there. And these forms tend to be so long, and I don't think many people read them, simply because there's not enough time in the day. So I don't think that particular issue is going to be affected by language. But the question is the idea of consent, right? I mean, just agreeing. Your doctor says, look, we could do this. What do you want? That could be affected by language. So the doctor using your language or foreign language for that, I would think that is going to make a difference. That will be very consistent with what we say. And I know that some hospitals, the doctors are actually using Spanish, even though it's not their native tongue. I don't know. Susan Levine's daughter is a doctor. I think she uses Spanish, Becky. And that might actually make a difference.
So I believe we've reached the end of our time, and I'd like to thank our panelists for a great lecture, great presentation. Thank our participants for some rich questions, and look forward to seeing you all at the next Michael Davis lecture. Thanks, Boaz.
Thank you very much.
Jeanette.
Yeah.
Thank you.